everyone, welcome back to my YouTube channel, and today we are going to talk about frontal bone. And here at the side you can see the diagrammatic representation of frontal bone for the reference. So let's start our topic introduction. Frontal bone is large singular bone at the front of skull. It forms the forehead, part of cranial roof and superior wall of orbit or eye socket. It also participates in formation of anterior cranial fossa that houses the frontal lobes of brain. Now let's talk about anatomical regions of frontal bone. It has squamous part, that is vertical portion, orbital part, that is horizontal portion, and nasal part. So let's talk about them one by one. First we will talk about squamous part, that is vertical portion of frontal bone. It forms the forehead. It marked by two smooth elevations called frontal eminence that are more prominent in children. It includes the glabella, that is a smooth, slightly depressed area between the eyebrows, and it contains the supraorbital margin with the supraorbital foramen or notch through which nerves and vessels pass to the forehead. Now let's talk about the second anatomical regions of frontal bone, that is orbital part or horizontal portion. It forms the roof of orbit. It is divided into two orbital pairs separated by a gap called the ethmoidal notch. The notch accommodates the ethmoid bone and contains small pits for ethmoidal air sinuses. Now let's talk about the third anatomical part or anatomical region of frontal bone, that is nasal part, that projects downward between the eyebrows and it articulates with the nasal bone, maxilla and nasal cartilage. It contains the nasal spine which contribute to the nasal septum. Now let's talk about frontal sinuses that are located just behind the superciliary arches, and they are air-filled cavities lined with mucosa. They are present by age 6 and grow through adolescence. Their function is to lighten the skull, humidify air, and enhance visogenes. They open into middle meatus of nasal cavity through frontonasal duct. Now let's talk about articulations of frontal bone. Frontal bone articulates with 12 bones. These bones are cranial bone, in which there is two parietal bone, one sphenoid bone, and one ethmoid bone. Facial bone, in which there is two nasal bone, two maxilla, two lacrimal, and two zygomatic bone. And all of these combine to form 12 articulations of frontal bone. So we will revise it. The articulation of frontal bones are with the two parietal bone, one sphenoid bone, and one ethmoid bone. And then it has articulation with two nasal bone, two maxilla, two lacrimal, and two zygomatic bone. The coronal suture marks its articulation with the parietal bone and is very important suture. Now let's talk about surface landmarks and attachments of frontal bone. First is superciliary arches that are prominent ridges above the orbits. Second surface landmark is temporal line, that is arched ridge that mark the attachment of temporalis muscle. Third is frontal crest, that is a midline ridge on the internal surface for the attachment of pelvic cerebri, that is a dural fold. Now let's talk about development and ossification of frontal bone. Frontal bone develops from two ossification centers in the embryo, initially separated by metopic suture which usually fuses by age 8. In some adults, a metopic suture persists partially or fully, and that phenomenon is known as metopism. Now let's talk about clinical relevance of frontal bone. First is frontal sinusitis. That is inflammation of frontal sinuses that can cause headache and facial pain. Second is fracture. That is trauma to the frontal bone that may lead to orbit-proof fracture or damage to the frontal lobe of brain. Third is surgical access. As neurosurgeons sometimes access the brain through the frontal bone through procedures like craniotomy. Now let's talk about conclusion of this lecture video. From shaping the human face to housing the frontal lobes and sinuses, the frontal bone is as functionally vital as it is structurally prominent. Understanding its anatomy is key in medicine, dentistry, neurology, and forensic sciences. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.